Okay, everybody, welcome. It is 11:30 and we've got a great presentation, I think, with a lot of information. So we're going to get started right away. So welcome to our injury prevention learning series. This is our spring safety. So we're going to talk about rock climbing safety today. We're joined by Deborah Witte and Carolyn Morgan. Great people coming to you guys with 20 plus years of climbing experience today. So I think it's going to be great. Just to let you guys know that there's no disclosures that we need to let you guys know for today's presentation. Our next presentation is going to be on May 4th. It's going to be on river safety by Allie Evans. She's one of the nurse educators in the emergency department. And then Karen Locke, who's the manager of the National Ability Center for Whitewater Rafting Program out of Moab, Utah. So that's also going to be a great presentation. So hopefully you can join us for that.
That looks great.
All right, cool.
Does that come up too? Or, oh, okay.
So thank you, Jamie, for inviting us. That was a cool introduction, and we really appreciate being able to come and talk to you guys today. So I'm Deb, this is Carolyn. This is a subject that we want to share with people because it's one that is super important to us. Carolyn's going to share a story that is very personal to her. And the reason that we're going to share this is because it really leads to a lot of the things that we're going to talk about today. Before we get into everything, this is a CME class, and so we want to go over to the objectives that we want to cover. We are going to review the case study. We're going to go over some accident statistics. We're going to just discuss some basic gear and common climbing mistakes. We'll identify some basic injury prevention measures. And then we really want to just get into discussing some key concepts related to climbing. Some of the foundation things that I think are going to keep coming up during this presentation because they're super important for anybody that either is in the sport, thinking about the sport, or moving forward in the sport. And then we're going to finish this presentation by talking about some basic first aid considerations, basic injury prevention, but we also want to close out by talking about what happens if you are involved in a big scene as a bystander. If something happens, what are some things that you can observe that are pretty simple that you can verbalize on the 911 call to help aid in sending the right equipment, the right team, and aid in extrication from the scene. And then hopefully we'll have a little bit of time for question and answers today. All right, so a little bit about me. I'm, like Jamie said, I'm Deb. I'm the chief flight nurse for AirMed. I have worked with the University of Utah for 16 years. I have enjoyed climbing for the last 20 years. I grew up in the backcountry of Utah, so I really love the outdoors. I really like climbing multi-pitch and have found myself getting into more alpine type climbing, multi-day type trips. And so when I met Carolyn about 3 years ago in the gym, through a mutual acquaintance, we really hit it off and found that we had a lot of things that we like to climb, a lot of type of climbing that we shared that was similar. And so we became quick best friends. One of the things that struck me about the story that we're going to share here in a few minutes is that prior to this event, we were climbing in Italy, and we'd been climbing for 10 days prior to this happening. And the terrain that we were in and the type of climbing that we were doing was much harder, much more involved. There was a much higher hazard. And so this really brings to light one of the things that we're going to focus on over and over here, which is major accidents that are preventable can happen in really benign, easy climbing. And so that really struck out to me because I thought, man, if something big happened in my life, it'd be during one of these big trips where a lot of stuff was going on. So you're going to hear us talk about a few concepts that are going to keep coming up. So safety first, making sure that you have the right partner, a systematic approach, a contingency plan, and then using your resources. So those concepts I want you to think about as we keep coming back to them. I'm in EMS myself, and one of the things that I have found in EMS is that a lot of us like to get in the backcountry. So I'm guessing with the audience that we have today that some of you probably have a lot of experience with climbing, and then some people might be new and some people might be interested. And we really wanted to have a presentation that has something for everybody. So without further ado, I'm going to have Carolyn introduce herself, and then she's going to tell her story.
Thanks, Deb. So I want to start my introduction by telling you I will never claim to be an expert in climbing. I'm sure Deb can agree. Neither one of us are experts. We don't know everything there is to know about climbing. I find that I learn new lessons and new safety standards every year. So with that said, I was born and raised in South Ogden, Utah. My dad, Roy West, was the one who first introduced me to rock climbing. I was around 5 when I first started bouldering on 26th Street boulders in Ogden. I got on ropes shortly after. I was very fortunate to be able to travel to the City of Rocks in Idaho at least once a month as a teenager. We were always camping and climbing together. My dad served on Weber County Search and Rescue Team for 35 years, and he served on South Ogden Fire Department for 25 years. So I have a ton of respect for my dad and for all of you in EMS listening to this. I know you all donate a lot of your free time to our community, and I applaud all of you for all of your many hours of service. Today, as was mentioned before, I am here because I want to share Dan's story with you. Some of the names in this story have been changed to protect the people involved, so keep that in mind. I met Dan Morgan October 2016. Dan and I met on a dating website, and our first date was climbing outside. From that point forward, we spent all of our free time together and planned many climbing adventures together. He was very spontaneous and was always looking for the next big adventure. 7 months after we met, we flew to Italy to climb the Faragnoni off the island of Capri. Dan had served an LDS mission in Italy, so he spoke Italian fluently, which made traveling to Italy spectacular. Dan proposed to me on the top of the mountain. It was a 4-pitch climb over 400 feet tall. Because this is a climbing presentation, I will explain to you that a multi-pitch is a climb that, like the name suggests, has more than one pitch. This particular climb was a sport route, meaning there were bolts to clip quick draws into and chains bolted to the rock for each pitch. So on this particular climb, it took 4 pitches to get to the top of the mountain. Dan would climb to the chains about 100 feet up. Then he would belay me from those chains and I would climb to him. And then we would repeat that until we reached the top. When you get to the top, you then rappel to each set of chains until you are safely on the ground. Rappelling, if you don't know, is where you lower yourself with your rope and etc. 4 months after he proposed, we were married. Dan had climbed for 8 years and was very confident and very strong. We were by far not the most experienced climbers, but we loved finding adventure. Dan and I were fortunate enough to travel to Italy together, and we climbed 4 major peaks. The tallest peak, Tre Cime, being 9,840 feet in elevation. We were in Italy climbing the Dolomites a total of 12 days. We had the time of our life. Dan was our tour guide and our climbing guide. It was spectacular. 2 weeks after we got home from Italy, July 2019, Dan and I met a group of people in the City of Rocks in Idaho. We had planned this for several months. We had met these people through a Facebook Messenger chat group. The group consisted of about 150 people. It was kind of like our own personal climbing partner finder. The group consisted mostly of newer climbers looking for help to get started. Someone on the group had suggested we should do a camping climbing trip, and Dan and I volunteered to go help set up top ropes for the newer climbers that weren't able to lead. 11 people were able to go on this trip. We had all previously met at local crags or at least the gym. Everyone was super excited to be there. I had set up the itinerary for the weekend because I was very familiar with the area and I knew what would be in the shade to climb. It was a hot July. Friday and Saturday, we set up top ropes and just had a fun time being around our group of people, cheering each other on. Sunday, July 21st, 2019, 6 of us went to Castle Rocks near the City of Rocks. It has a taller peak with easier multi-pitch climbs. Several people asked if we would lead them on the classic climb Big Time. Shown on this slide is Big Time on the right. It's a 400-foot peak, and they knew I'd be able to take, they knew I had taken several family members and several groups up this multi-pitch climb. Everyone that day, though, having the skills to get to the top, they unfortunately after talking to everybody, they unfortunately did not feel comfortable rappelling. I quickly nixed the big wall plan and let them all know I was happy to teach them how to rappel, and I knew a great spot to take them. We went to the west side of Castle Rocks and chose to climb Slab Happy, an easy enough climb to top rope for most, and it has a great ledge on the top to comfortably tie yourself into the chains with a personal anchor system, otherwise known as the PAS. We had enough people that someone on the ground would also be able to safely assist with the fireman's belay. A fireman's belay is where a person on the bottom holds the ropes, and if there is any danger, the person can pull tight on the ropes and lock the person rappelling on the wall on their spot. I just want to point out in this picture, this is one pitch of big time, just to give you perspective of how big the rock is. You can see tiny people on the right. That's about 100 feet is all. So we got to the crag, and Dan said he would like to make the most of our time and set up another top rope on Red Rib. It's a harder climb to the right of Slab Happy, so we could be doing 2 climbs at the same time. I got set up to lead Slab Happy as Dan got on Mountain Project, an online app that has most climbing crags listed that you can get information about. He was trying to figure out how many quick draws he needed to climb the route. He read out loud to the group, Red Rib is a long, beautiful single pitch route up the southwest ridge of Castle Rock. He then stopped reading and he skimmed the notes to himself. He didn't find what he was looking for, so he just decided he would take 16 draws. He had a 70-meter rope, and Jenny volunteered to belay him. Ropes are in meters. 70 meters, for every meter, it's about 3 feet. So 210 feet approximately is a 70-meter rope, just to give you guys a point of view of that. Jenny had put Dan on belay, while my partner Mike put me on belay. We both started climbing about the same time. My climb was super mellow, and I got to the chains and tied into the chains with my PAS. I threw my rope down to my partner Mike because he wanted to lead Slab Happy as well. Sarah down below belayed Mike on Slab Happy, and he got to the top where I was waiting. As Mike got to me, we saw Dan just finishing his climb. Mike put himself on the chains with his PAS, and then he took a quick picture of Dan at the top of his climb, and we both heard him say, "Take." This is instruction telling the belay partner to take all the slack from the rope in and make sure she has him tight. Then we heard him say, "Lower." Then Mike and I saw Dan free fall quickly down the mountain. He had time to say, "Oh shit, oh shit." I always get choked up. It's very real. Dan and I did not know exactly what had happened, but I knew I needed to get down to Dan. Mike had some experience rappelling. He just needed a refresher. So I put myself on rappel and I made sure Mike was okay with me leaving him. And I lowered down to where Dan was. We have estimated that Dan had fallen approximately 120 feet and landed about 20 feet above his belayer. When I got to Dan, he was on his bum, slouched forward with one leg dangling off the ledge and the other folded beneath him. He was snoring. At the time, I did not know what that meant. I'm sure many of you know what that means. Mike got down to where Dan and I were, and he had 911 dispatch on the phone. I let them know he was snoring. They sent a helicopter that arrived about 30 minutes after the accident occurred, and City of Rocks rescue rangers reached us about the same time. Mike and I had basic first aid skills and knew to keep Dan stable, and we kept our hands on his arms and chest for comfort. Sarah and Jenny and Andrew were on the ground below and could not see where Dan had landed. I lowered down to them and let them know I didn't think Dan was going to make it, but we would all get through this together. This was an accident. Something to note here, the rescue rangers got up to us. It was a very hot July. I think it was 95 degrees that day. Someone did get dehydrated. Pack water. What happened in this accident? There's so many questions. What happened? There were so many mistakes made that day. As I mentioned before, there were made up names in this story. The girl that belayed Dan, I have not even disclosed to his family. It was never necessary. Blaming and pointing fingers is not what this story is about. No one person is at fault. My purpose of sharing Dan's story is solely for education. The 6 of us got up to the cliff a little too relaxed and comfortable with one another. Sure, we all knew how to climb and belay. All of us had done it at least in the gym before. Dan's belayer that day unfortunately had only gym climbed. She only had experience with a short gym rope until this weekend. The first mistake was complacency. Climbing should never just be a casual outing. There always needs to be a clear plan and awareness of what the plan is. Dan chose a climb last minute and didn't clearly have knowledge of what the climb was, and we did not have our guidebook with us. A guidebook in this case had a shorter description, and it tells you to use 2 ropes to rappel from the route. Maybe he would have read that and figured it out, maybe. Mountain Project has updated the description to add on the second line, you need 2 ropes to rappel. As shown in this on the second slide is the updated version. I also would like to warn you about climbing in the City of Rocks at this time. It was developed in a time where men were pushing their limits and bolting to show how bold they can be, not necessarily how safe they could be. There were only 12 bolts on this route, 12 bolts for 195 feet. I safely climbed this climb on Dan's 1-year anniversary, and it had 20 and 30-foot runouts between some bolts. I've climbed in the city recently and discovered several more routes with bold runouts. We determined if one were to fall on any of these runouts, it would be at least a 40-foot fall. The big questions you should ask yourself before you climb: how tall is this climb? How long of a rope do I need? How many draws does it take? Is this a modern sport route? Is this an alpine route? Is this a trad or traditional route? If you're in a different country, study their guidebooks and topos. Climbing in Italy was a completely different experience, and there are different ways they develop their routes as well. The second mistake, there was never a knot tied in the end of the rope. Dan read the description out loud from Mountain Project, but pretty much just paid attention to long single pitch. He was only really interested in trying to find how many draws he needed after he read that. He ignored the big keynotes on the screen. I circled them for you. It said 195 feet was listed on the top clearly. It tells you the route's length. Dan had a 70-meter rope, which is approximately 229 feet. If he would have paid attention to that detail, he would have looked closer at how to get off the route. At the very least, because he was in doubt, he should have tied a knot at the end of the rope. This would have saved his life. When Jenny was told to lower, she followed Dan's command. There was only 10 meters of rope on the ground. She lowered him, and as the 10 meters went through the belay device, the end of the rope slipped through her hands, through the belay device, and up the mountain through the quick draws. If a knot would have been tied, it would have stopped at the belay device. Jenny would have possibly been thrown up to the first quick draw, but no one would have died that day. In Dan's defense, it's a travesty that on Mountain Project, it describes this climb as a single pitch. The guidebook states stellar pitch. A single pitch. In all my years climbing, I have never climbed a single pitch that was longer than 110 feet. The definition of single pitch in the guidebook, Mountaineering Freedom of the Hills, states, a single pitch traditionally ends at bolted anchors, and the pitch is often short enough that the leader can lower back to the ground by the belayer. Dan climbed to the bolted anchors. If you Google single pitch, it states a climber can safely rappel or walk off unroped from the top. A single pitch is also traditionally, it's traditionally a maximum of 110 feet. A 70-meter rope is typically the longest rope sold because there are rarely single pitches that are longer than what a 70-meter can rappel safely from. I emphasize typically because nowadays, more modern routes, we are starting to need an 80-meter rope. If Dan would have paid attention to the 195 feet, he could have planned accordingly. With a multi-pitch, you tie your belay partner to the end of the rope. He could have tied his belayer to the end of the rope, and when he got to the top of the route, he could have put his partner on belay, and they would have climbed up to him. Then they could have safely rappelled to the chains recommended for the route, which the guidebook suggests there are chains to the right, making 2 or 3 rappels. The third mistake, Jenny was never trained on what a middle mark on a rope means. That particular day, they used a brand new, bright red rope with a very big black mark to mark the middle of the rope. When Jenny would have seen that black mark go past her and up towards Dan, she could have yelled out to him, Dan, you've reached the middle of the rope. You see chains, and so forth. At that point, they would have known their rope was not long enough, or there needed to be another way to climb the route safely. In conclusion, even the most experienced climbers can make deadly mistakes. Please take this as a reminder to always be prepared and have a clear plan. If you're tired and distracted, you can get complacent. Make sure your partner is trained and comfortable and knows at least the biggest safety rules in climbing. Deb?
Thank you, Carolyn. That's such a close personal story. And the reason that I feel like this was so important to share with everybody is because when we start to look at the climbing accident statistics, they're right in line with exactly what Carolyn described. There was a number of basic mistakes made, but guys, these basic mistakes comprise the biggest number of death, climbing related accidents that result in death out there. So I'm not going to go over every single one of the accident statistics, but some of the things to highlight in there, number of injuries is seen in the US emergency rooms now going up. That's not surprising. I think, as we've all been dealing with COVID and people are flooding to the outside to get involved in outdoor sports, that's not very surprising. But one of the things that should tell you is that perhaps we're not doing enough basic groundwork when we're getting ready to get into a sport like this. We're going to keep circling back to speaking up and having a mentor. But really, if you don't feel comfortable speaking up, then you either have the wrong mentor or you are in the wrong sport. And so that's a concept that we really want you to get familiar with. One of the other accident statistics that is worth noting, and again, this didn't occur necessarily in the afternoon, but you'll see most accidents happening on the weekends, which happened in Carolyn's story. But it happened with people that were getting compliant. They had been out there, or complacent, excuse me. They had been out there for a few days. And it's really easy to do. We all say we're going to stay focused and at attention throughout our climbing trip, but that really isn't the way things happen when people get exhausted. And so paying attention to the critical times, which we'll talk about a little bit later. Climbing accounts for approximately 10% of all mountain sport related accidents. So when you think about how many things there are to do outside in what counts for mountain sport related accidents, that's a huge number. Again, there's some basic concepts you need to have in place before going out and taking a sport like this on. Males, I don't think that that's a big surprising one when you combine that with the age group that you see. Males tend to be at their physical prime, as well as tend to be engaged in a higher level of risk and pushing it. So that's not really surprising to me. But more experienced climbers, I highlighted that one because I think it's important to note sometimes getting into a sport, you're almost at an advantage because you have a little bit more respect for what can happen. You don't know as much, so maybe you are more prone to ask more questions. But then as you get comfortable with the sport and want to push things, it's really in the 3 to 5 year mark where I think people tend to get a little too comfortable. Their climbing is expanding, their experience is expanding, but there's a lot that comes with that expanding knowledge. And so really not taking for granted having only, getting into the 3 to 5 year mark, there's still a lot to know. I learn something every time I go outside, especially on some of these bigger trips. So you always have to be open to learning and realizing that you don't know everything, and that even if you feel like you do have a good foundation, there are so many unknowns that can still come up. So belay incidents, so that statistic ranges quite large from 12 to 20%, but regardless of what the spread is, because I did find different statistics on that, it really doesn't matter. 12 to 20%, no matter what percentage that is super high. That means that one of the highest causes of accident-related injuries has to do with something that is 100% preventable. So if you go through there, in the other list, I just listed some of the other things that tend to be maybe hazard-related, environmental factors, and other things that we'll talk about taking into account a little bit later. Other factors that are worth mentioning, Carolyn briefly talked about this a little bit, but developmental of climbing areas. Not every climbing area was developed the same. In fact, they are developed very differerly. Climbing in Italy, like she said, was very different than climbing in City of Rocks. But even if we just take the immediate area in which we live in the Wasatch Front, little cottonwoods, very different from big cottonwoods, very different from American fork. They're bolted differently. They were established at different times. And a lot of the routes were established with different rope lengths in mind. So when climbing first was established and started to get popular, most of the routes didn't exceed being able to use a 50-meter rope. So as things grew, we've gotten to the 60-meter, 70-meter, and now in some areas, we're putting up super tall climbs that you have to have an 80-meter climb or you're not going to be safe on it.
I was going to add, when you go outside, you have to keep in mind that routes are developed by private parties. I didn't actually know this for a long time. It's outdoor bolts differ from area to area, as she was saying. But the person developing the route is the one that puts the time and money into the hardware. Sometimes you look at a route, I think we found something in Red Rock that had a bolt from Home Depot that was terrifying. Right. On the bad bolts, it shows the SMC steel plated SMC known as the death hanger. These were in the 70s and 80s. They didn't even need any weight on them to crack. There was just something in them that was faulty. In the 1980s, they started repairing or fixing them and sending them out with let's see, it was, I'm sorry, making them with stainless steel. Yeah, that was right. And they were much safer. The developer is the one that decides how long the climb is. Like she said, make sure you know if it's a 60, 70, or 80. If you need to carry a second rope up with. So, and
some of these factors too, just in bolting, regardless of how they were bolted, if you're climbing somewhere where you're next to the sea, some of the erosion factors are going to be quite differently than some of the higher, drier geographical areas. Some of the local areas that we climb in, we're fortunate enough to have some organizations that we'll kind of mention later that, are heading up rebolting projects, but you have to do your research when you're getting ready to go out there and not necessarily assume that everything's going to be in good condition and ready to climb and safe to bolt. We're going to jump back from some of the things we've been talking about to start from the basics and move our way forward from talking about some of the basic equipment, and then we'll move into some of the climbing concepts and injury prevention.
So basic gear is something that you can, when you're going to start going climbing, I would highly recommend going to one of your local gyms and starting. It's a day pass. They'll get you on the road to start to learn how to belay. First step. I think that's most important. All the gyms have classes online that you can get into and pay to get into a class. Basic climbing gear for bouldering in the gym, shoes and chalk is all you need to start with. If you're going to start sport climbing, you need to add a harness, belay devices. I recommend an assisted belay device, a 40-meter rope for the gym. And then if you're going outside, I wouldn't go anything less than a 70-meter rope, comfortable climbing bag, quick draws, helmet for belaying and for climbing. Deb and I are shown here. We are using our PAS. As I spoke earlier, it shows the red rope that has two is my PAS hooked to me, and I'm also hooked to the green rope. Deb's hooked to the green rope and her orange PAS. Locking carabiners to lock them into your bolts. Bellbiner it's a quick link. I can't tell you how many times I've climbed up a route and couldn't get it. I couldn't get to the top, and I didn't want to leave an expensive piece of gear. So I put in a bellbiner and just bailed off the route. This is a bunch of variety of ATCs and belay devices, the assisted belay devices. And then water, always pack water. Here's another picture of the rope with the middle mark. Know what kind of rope you're buying. That's really important to know. There's dynamic and static. A static rope is specifically just for hauling your gear or rappelling possibly. But my nephew made the mistake of buying a rope online, and it was cheap, and he wanted to get started, and he called me and asked if it was good. I was like, no, you do not climb on that rope. So
yeah, and we included this screenshot not because we're necessarily trying to sell you Black Diamond or anyone provider of rope. So the brand isn't super important. The concept from this we want you to take away is this gives a nice little example of just looking at a rope and knowing what it is you're looking for. There's a lot of variety in this particular menu page alone, but we want to point out, you know, being aware of what kind of diameter in the rope that you need. There's a lot to choose from, and it's going to be very specific to the type of climbing that you're doing, the treatment that the rope has. So in other words, whether you're going to use it for wet environments or ice climbing, how heavy you need it to be, how dynamic it is, meaning how many types of falls you expect to take on it, and how dynamic you need the rope to be before it loses that ability to be as dynamic and needs to be switched out. And then, like Carolyn said, the static rope, that's not something that should be tied to a climber. That's something where you're hauling gear. You can use it for big walls, and it's certainly involved in climbing, but not something a person can be tied to. And we Googled climbing rope the other day and found one for $11.99 on Walmart. So again, this is why we're bringing up having a mentor or some of our local resources like IME and the Gear Room, where, you know, it's run by people who are climbers who can, you know, listen to what it is you intend to get into and help guide you and give you some expertise involvement on what kind of gear you're choosing, from chalk bags to shoes to ropes and such.
I agree. And with IME or the Gear Room, they are locals that are bolting up those routes, and they will give you more information than your other local climbing shops. IME, they're there to help you and mentor you. If you have questions, there is no dumb question you can ask them. Those guys are the owners there that are working all the time, and they know what they're talking about.
And they're also involved in a lot of the safety awareness and rebolting projects. So we included this slide because we just really want to briefly spend a second talking about the different types of climbing, just for those of you who maybe don't know. This picture is there to illustrate traditional or trad climbing. And by that, you can see next to my right foot where I'm placing gear for protection and then clipping the quick draw to it. So on traditional routes, you're going to be putting in your own protection with cams and different nuts and different things to protect your fall. And there may or may not be a set of anchors at the top. So again, something that you need to research when you're getting ready to climb. Sport climbing is the type of climbing where it's pre-bolted. Now, again, it could be run out and not be bolted very close together, but it's pre-bolted to the top of the climb. And so it's just the type of route established depends on what the original route establisher saw in mind, but just to be aware of both of those type of climbings. Traditional climbing, as you can see, you end up carrying a lot more gear for protection and placement. I included this picture. I hope that it illustrates what I'm trying to show. If you look at those, I'm sure the experts pick it out really quickly, but this is just to illustrate that sometimes when I've had people look at this picture and say, well, I don't really see what's wrong with that gear. But if you notice the gear on the right, it has a little bit different metal stem on it. But when you particularly look at the wire down by the finger pinch, you'll see that it's not actually wired and lined correctly. So when you go to set that, you might not be able to set it in a timely manner, and it might get stuck because it's not releasing the way that you need it to. So that would be considered an older piece of gear that's in disrepair. On the left-hand side is the same size of a cam, but it's made with a little bit different metal so that it's lighter. We love that one because you can hike back into the high country and use it with a lot less weight. You can see that the stem is designed a little bit differently and with weight in mind. And the metal on the left side, because it's lighter, would wear down a lot quicker depending on use than the metal on the right side. So the point to glean from this is when you get ready to buy some gear, it is really tempting to find some on KSL or Mountain Project But gear is not all the same. Again, I would defer to an expert to be able to look over the condition. There's a lot of gear out there for sale that's not worth buying. And
You don't know where it's been stored. You don't know how old it is. Some of them have dates on them. You don't want to be climbing on old gear unless you know that you can trust who sold it to you and you know it's been stored correctly. These are life-saving items. You don't want to go with old. You want to buy new.
And I didn't even mention the webbing, but you can see the webbing from the carabiner down to the piece of gear. Those really get dry and worn over time. So really things to be aware of. Have somebody help you, especially when you're first getting into the sport and buying up some gear. I included this picture just because we keep hitting on safety and we can't hit it home enough. This for me was actually an ice climbing trip this last year. Outside, and I say trip, but it was actually a day. So, but the point is I was hit on the head with a big piece of ice, and I wouldn't be giving this presentation had I not been using my safety gear. It's so tempting to get out into the sun and enjoy the sun and the wind through your hair and not wear the helmet, but there's falling rocks, there's goats above some of the places that you climb. You don't know what's going to fall. Even if you're the belayer and you're not even the climber, they kick off pieces of rocks or something can break loose. And if it hits your belayer in the head, both of you can be in serious trouble. So we can't drive home using your safety gear enough.
This is just a silly picture. On the left is the correct way to belay. On the right, obviously I have way too much slack out. There's no way I'm going to catch him if he falls. Also, I'm not wearing a helmet. He's not wearing a helmet on the ground, as Deb just emphasized. We were just goofing around for this picture, but I do agree. You definitely need to wear a helmet on the ground as well.
And it sounds silly, but this stuff happens all the time. People come up with cell phones and questions. So we just took a picture of distracted belaying, but
this happens all the time. And if you'll notice his hand on the right is pointing to the phone, and that's his brake hand he's taken off of his belay device. This is an assisted belay device. It is a little safer to do that with, but you should always keep your brake hand on the right side of the road. So this is very dangerous, actually.
Examples of what not to do.
Right.
So we're going to switch gears and talk about injury prevention that is specific to climbing. So I don't want to get into every little concept here. I will provide all of these slides for Jamie, and then again, it'll be posted. So you guys are welcome to go through this or reach out and ask questions, but these are general conceptual things. The basic concept from this slide is when you get ready to climb, I know that it's fun to run in and get started climbing. You usually have only a certain amount of time, but when you're talking about climbing related injuries, it's kind of the same concept as any other sport where you are going to really get the blood moving, go from 0 to 60 fast. You want to get the blood moving. You need to get the blood increasing your circulation through the muscles, particularly your shoulders, your fingers, your legs. It depends on what type of climbing you're going to be doing, but you really want to have your fingers be able to do the crimps that you want them to and not get injured, and warming up is super, super important. Yoga, for those of you who are into yoga or stretching, that is definitely optimal for a sport like this. Getting your joints lubed up, getting the flexibility increased will reduce things that happen so easily and so frequently, and nothing's worse than having your summer ruined by not being able to do this stuff. And some of this is just super simple movements: head rolls, warming up your shoulders, turning your body, getting your trunk warmed up, side twist. I really like this illustration on the right-hand side for the 512 climber. So we're not all 512 climbers, but I really like how this shows you that if you take the example of a 512 climber and that's your max, then you really want to drop down somewhere in at least the low 511s, even the 510s, to warm up to your max capacity. You don't want to run in there, show everybody what you can do and what your hardest climb is right away, because you're setting yourself up for injury. So backing up a couple grades, warming all the muscles up, and then working into that. And then sounds pretty basic, but this one's it's hard for a lot of us who are on the go all the time: rest. If your body is telling you it needs some rest, listen to it. Sometimes the best thing for improving your climbing is not climbing for a couple days. These might not be the top 7 climbing injuries, but it's kind of the average of what I was seeing when I was doing some research for this. But it does cover some of the most important and the ones that you see the most. Finger pulley tears, again, simple fix is really getting the blood moving, loosening up and stretching. I do want to point out, when you're getting into climbing, the tendency is to get in there and you see somebody that's better than you, that's doing some major cool climb, Gastoning, all these fun terms that you hear, and you're like, I want to do that. The problem with that is, the more technical and the higher grade you get into, the harder it gets for your body. And your muscles might be able to catch up far faster than your tendons. And if you've ever had any kind of orthopedic surgery, particularly for your shoulders, you know that your doctor has said, absolutely not, your tendons are going to heal and get stronger way behind your muscles. So you will not go out there and do something that you feel okay to do. You've got to let your tendons heal from this surgery. And that's really, without the surgery, just getting into the sport, what you need to think about is that your tendons in your fingers and hands are going to be way behind what your muscles in your shoulders, back, and arms can do. So let your tendons catch up. The tendonitis on there, that's your body telling you something is going on. Don't override that and push through that, because again, tendonitis is telling you need a rest, you need to do something different, you need to let something heal. And if you address the things as they start to come up and you're feeling that something is not right, and allow your body the chance to rest, it makes for a lot better climbing later and really avoiding setting out a season or so. Cracked feet, this one sounds funny, but most climbers will be able to attest to the fact that we've all gotten to a crag or a trip, and if our skin was in disarray, or we were going through the winter and our cuticles are cracked and our feet are cracked, it can really ruin some great days trying to push your feet into a tight little climbing shoe, and you had a great project in mind that you can't make it through now because of the pain. So keeping your feet and hands in good order with clipping the nails, it sounds simple, but it's easy to forget when you're in a hurry to get climbing, and deserves some notable attention. Abrasions, we'll talk about this with the first aid kit, but tape and proper attire will help prevent the sunburns, the abrasions, and just tape's good for everything. So we'll bring that up again later. Now, I want to switch gears. We've talked about some of the basic prevention. We've talked about some of the basic gear. Let's talk about concepts. This one's super important. I come from the air medical. This Swiss cheese model was born out of the FAA, had to do with one of the bigger airline crashes. But this model is a great way of conceptualizing risk and hazard prevention and hazard mitigation in the safety systems that we set up. So I've seen this kind of work its way across out of the FAA into a lot of areas in EMS, in different businesses. And I really like it for climbing, because as you build on your climbing, you'll likely start at the gym or day trips, but usually, more often than not, you're going to build on something simple and start expanding that to day trips, multi-day trips, other climbing. And so this is super important to keep in mind. So this is a way of conceptualizing a systematic approach to the metaphor of defense layers. So if you think about each layer of cheese being a different defense layer, we've labeled them planning, adaptation, preparation, and then backing off. If you think about each of the holes in there being different areas of weakness. So for instance, if you look at the planning stage, a mistake or hole might be that you meant to meet at your multi-pitch route at 4 a.m. and your alarm didn't go off. And so now you're rushed. So that's a weakness getting ready to set up. Now you should have this other layer of adaptation, but an example of a weakness there might be that the weather conditions changed and you didn't pack warm clothing because you didn't think that you wanted to carry that weight. So now you've got two layers of weakness. An example of that in the preparation layer might be that you neglected to pack a first aid kit because you didn't think you would need one. It was going to be a short trip, and then somebody got injured. So those different areas of weakness can always move around and be something different. The problem is that when you have those areas of weakness and those holes line up, as demonstrated by that arrow going down through the holes, that's when catastrophic things can happen. It's when our safety system doesn't line up and allow something to go all the way through and a big incident happens. And so this is where we start to talk about our hazard inventory. One of the great sources that I really liked when I was getting ready for this was the Accidents in North American Climbing. They put out a yearly publishment about all the accidents in North America that happened, and then they break down all the accidents. In the one for 2019, and this is put out by the American Alpine Club, and one of the, in the 2019 book, they have this great article about mitigating hazard and risk and analyzing risk. I just took one simple concept out of this that I want to briefly talk about, but I would really encourage people to try to get a hold of that article and take a look. The full article is definitely worth reading. One of the things to kind of glean from our risk mitigation that we just talked about and comparing it to hazard is the fact that hazard and risk is not the same. I think sometimes we put them in the same category, but I really like how this demonstrates that hazard is an objective measurement tool. So we know what the hazard is. We can assess it. If we go outside, we know the area we're going to be in. We know what the weather is. We know what the rock type is. We can objectify that, and we can kind of rate it and get a good idea of what it is. The risk is the level of our exposure to that hazard. So that's something that we decide based on what we know about ourselves. Is our capacity to climb this? Do we have the skill to do that? Is our partner capable of doing that as well? Did all the planning tools, did all those different layers of risk mitigation come into place? And so the thing from this to think about is those are ever changing. Putting the hazard and analyzing that with the risk is always kind of changing. It's going to be different. And so certain times they're both going to be low, and that's your green area. It's kind of a no-brainer. Yeah, go for it. Then there's other times where it's an obvious no. I'm not prepared. I'm not feeling good today. I'm just not 100%. And it's kind of raining outside, might be set up for an afternoon storm with some ice and conditions aren't right. Boom, I know not to do that. Then you've got all these layers of yellow. And what you see there is there's more layers of yellow than there are obvious yeses or nos. And that's what you have to think about, is you have to take those factors that aren't always obviously going to be yes or no and really sit down and think about a plan. So I really like that concept.
And with this book, the accident books, so Dan's story is in the 2020 version, I believe. It happened in 2019, but they got the story for the 2020. Those accidents are so, you can learn so much from those books. Okay,
is that what we had up?
Yes, that's the slide you get started on.
I think we finished with that too. Oh, we're still talking about that. Great.
Mm-hmm.
You just started considerations. Go ahead and go to the next screen.
So, sorry, you guys. I'm not sure what happened. Of course, the one day that I have issues with the connection. So going back to the considerations and concepts, safety first, systematic approach. When we address things and approach our safety in EMS, we do stuff the same way every single time. It's a standardized approach. And the reason that it's standardized is so that you get in the habit of doing things the same way every time. And when something falls outside of that standard way, or you have an unforeseen issue come up, you've done it enough times the same way that it will definitely stand out as not fitting in within the systematic approach. And so when you apply that to climbing, you're always going to do your safety check the same way each time. You're going to check your gear the same way. You're going to check each other the same way. You're going to just move down your list of things the same way every time.
You know, the famous
Yeah.
climber, Lynn Hill, was at a competition, and this is kind of a famous story. She was just chatting with somebody as she was tying her rope, got distracted, started her climb, finished it, said, take, lower. She fell to the ground. It was a 30-foot climb or so. She's okay. She's alive today. But she hadn't tied her rope properly. And so you always have to make sure you do your checks. Anyway. And what I was saying about the book earlier, if you didn't catch it, Dan's stories in the 2020 version of the accidents report. 2019 is the book that Deb was referring to. You can learn a ton from those books, is what we were saying. So
yeah, it's people that are going through a lot of these same concepts and miss something, and they're talking through how that got set up and how easy it was to do. And and you guys, I think every single one of us has at least one story where we were trying to do the right thing and with the right approach, and have been able to list at least one of these things that could have resulted in death.
all of us have a story that, oh man, that was a close call. Duh, I need to think harder. My dad said something powerful the other day. He said, there's not enough negativity talked about when you go up to a crag. And ever since Dan's accident, I 100% every time I go to a crag is, okay, what bad can happen today? When someone's climbing, how far would they fall when they're clipping? I'm just constantly in the back of my mind being more cautious.
Right. And when you're getting to the crag, are you reviewing the plan with your partner? Again, if you're not able to speak up and ask the questions that don't make sense, or the things you don't feel like you're on the same page, then you're not with the right partner, or not in the right sport. You should be reviewing the plan. Hey, when you get to the top, what are you going to do? Are you going to say this? Do you want me to do that? Are you lowering down? What are we doing if such and such happens? Reviewing the plan, I can't speak to enough, because we're going to talk about it a little bit again with some of the first aid things when something happens. If you didn't have a plan in place before, it certainly isn't the time that you're going to come up with a constructive plan then. And so, dirt diving these things over and over again and talking about them is super important. And then the last thing here, going back to that last protection model of the Swiss cheese model, what is your hard stop? So you might have your planning, your adaptation, all of those things into place, and you get to the place and something doesn't add up, and it's so hard to let go of that project and that trip and say, it's time to turn around. Today's not the day.
Deb and I were in Italy and climbing a 6-pitch climb. It was a beautiful day. I think we were on the 3rd pitch, and a hailstorm came in from nowhere. And Dan and Deb and I had to just bag it, and we were super disappointed because this was like one of the big climbs we wanted to do, and we were super stoked, and we just had to bag it and rappel our way down safely because there was no climbing in a hailstorm on limestone. It was too slick. So
yep. And what is your hard stop? And that hard stop, I believe every single mountaineer and alpinist has a story where they spent a lot of money and time, and that was their goal, and because they were able to have their hard stop and kept to it, they're able to be here today doing more climbs. Critical times to focus. Again, just keep in mind, there's times when it's okay to chat about stuff, how the day is going, other things in your life. And then there's time to really dial down and focus into what you're doing. Tying up, like Carolyn talked about Lynn Hill. When you're getting ready to lower, when you're both at the top of the climb and it's time to rappel down, all of those things are really high consequence moments where if you're not just taking a second to do the safety checks in your systematic approach, then things can happen. And I also want to point out, I love this slide because this is my little girl who's my little climbing buddy. I'm doing her first lead down in Maple Canyon on, I think it was Catch It Man or something like that. Anyway, moving over to some first aid considerations. We just want to talk about some basic first aid considerations and then follow that up with what happens if you're a bystander and somebody gets hurt. I'm not going to spend a lot of time on the personal first aid kit. I listed some things here. Headlamp though, always take it, always take tape. Take a small knife. We have a story where, this was the first year that I was down in Red Rocks. I'd never carried a small knife with me because most of the time you don't need it. It's down in your bag. And I was 4 pitches up and me and my partner, he threw the ropes. we had 2 ropes because of the descent, and threw the ropes, and it got stuck in the one sort of small crack in the top pitch. And had we not been able to have a rope on hand and cut the ropes and then retie and figure out a whole, like, it was a little bit of an epic, but it wasn't the epic it could have turned into had we not had the knife. So
know how to tie 2 ropes together too.
yeah. But these small things, an ounce of prevention means a huge navigation through, you know, some event that will really help save your day, the trip, or your life. Butterfly stitches or super glue, I would include these in your kit. Really easy to get. Super glue is amazing. And butterfly stitches are available at REI. These are just really great ways to patch your way through the day or a trip. Water purification tablets. If you're doing something multi-day, you might run out of water. A great, simple, light thing to have. Not everybody wants to have a SAM splint. Those are things to consider. A tourniquet. I love when people know how to use a tourniquet and have it with you. I think it's amazing for hemorrhage. So we'll talk about that in a second. But a spot device is a great way to be able to send a signal, and or on some of the devices you can send messages to loved ones and say, hey, we got here, we're at the top. Hey, we've descended, we're safely off the rock. But in an emergency event, it can send your exact coordinates, which can help a search and rescue team or a helicopter get you much quicker with the exact coordinates. So really amazing piece of equipment to have with you, and they're pretty affordable. And, you know, I typically, when I go out with bigger trips, generally one of us will have one. Stop the bleed. So for those of you who are going to carry tourniquets, I'm not going to spend some time. Again, these are resources that you can look up later, but I do want to highlight, if you're going to carry a tourniquet, know how to use it. The University of Utah and other areas in the community offer some of these classes. Being able to use a tourniquet can be a life-saving measure for somebody. Once somebody gets injured, time is of the essence. That's kind of why I wanted to talk about this and close out with some of the considerations for what happens in the event that something happens. So if something happens, there's a few things that you can tell the 911 dispatcher that are going to make a huge difference on sending the right helicopter, the right team, and the right equipment with the right medications and the right treatment. Oftentimes the climbing crags are not right close in the community, and it's going to be a little bit of a trip. While they're flying out there, the medical team or the search and rescue team or EMS is getting their stuff ready. If you're able to observe somebody who is injured and say, hey, they hit their head, they're not acting right. They're really not totally awake. Verbal cues like that, they can start getting 3%, they can start getting medications that will shrink their brain, give a little bit more space in the skull, so that while they're transporting or treating the patient, it might give the difference of enough time that they can get to definitive treatment. So being able to verbally cue what you're seeing, are they breathing? How are they breathing? Is their chest open? They can bring needle decompression, dart the chest, place chest tubes, be ready for intubation, and come right up to the scene with those things. Do they need a hoist? So I used this slide to show you, this is an actual climbing related call in Little Cottonwood Canyon a couple of years ago with our team. Oftentimes the helicopter can land right there. I think City of Rocks can land right there. But that isn't always the case. And maybe they're located up on a precipice or a place between pitches where you really need a hoist. And so being able to say what you're observing and kind of think about those details helps send some of the right equipment quicker to you. Bleeding, you can makeshift a pelvic binder, but if you're able to say, oh, they're really bleeding, they're bleeding out of this place, they can bring the right equipment, place a pelvic binder. A lot of the air medical teams carry blood now, so these can be the difference between getting from the scene to a hospital. Another thing is the GPS coordinates. Try to designate somebody right away if you do not have a spot to say, I need to look up the GPS coordinates. If you have one of those apps and you're able to provide those, it really can make the difference of 10 to 15 minutes to get to you quicker while they're flying. So any of those specifics, location, scene, what is the extrication off the scene going to be like? How hard is it to get to us and get us down the hill? Those descriptions can really help problem solve as they're coming, instead of, you know, congregating and spending the time because there's a lack of information. Time of injury is helpful. It just kind of helps give a timeline of what they're working with. Here's one that stuck out to me a little bit when Carolyn was telling me about what happened with Dan, and she described the 911 call. You know, your adrenaline's going pretty heavily. And she said, I couldn't even, you know, it was really hard even to remember my own phone number. And that's why we're talking about it now and drilling this stuff down right now, because at the time something happens, your adrenaline, your tunnel vision, your brains, its natural ability to process and handle that information starts to get tunnel vision, and for all the list of things that you normally would remember is reduced to sometimes half or sometimes less. And if you can even remember all these items when something happens, I'll be super proud of you. But the more you go over it and the more you talk about it and the more you plan, the better outcome you're going to have with some of this stuff.
I do always make sure now also that whoever I'm climbing with has my significant other or family members' personal information, so that if there is an emergency, they can contact the right people. Sometimes you're climbing with somebody that doesn't know any of your information other than your phone number. Make sure they have someone else's phone number in your personal emergency contacts.
Yeah, that's a good point. The scene gets pretty chaotic. There's a lot going on, and having a designated person to handle the information and be able to relay stuff to the family or the needed people and be the contact is super helpful as well. So circling back, safety first, contingency plan, know your resources, making your plan and discussing that plan with your partner. We're not going to go through all of these things, but we've talked a lot about resources, and starting with the resources at local gyms for basic falling, climbing, safety, belaying classes, to guide services. There's lots of professional training. And if you're really going to build on your climbing knowledge, get outside, spend time teaching people, getting involved in the community. I really encourage you to take a look at some of these NOLS or AMGA classes. You can build on, you know, guide services, skills courses, certification services. And then that also has a lot of involvement with some of the professional organizations, the American Alpine Club, the Salt Lake Climbers Alliance. Both of these carry initiatives to spread knowledge about safety and climbing knowledge in the community. That's also a reason that we like some of the local climbing businesses, because they're involved with these organizations. We want to spread the word on how to climb safe and what the climbing areas are like. And lastly, there's a lot of climbing podcasts, but one of my favorite is the Sharp End podcast. It's about accidents in North American mountaineering. And this is also similar to the accidents in North American climbing that we talked about with the publication. It's just a great way to listen to some of the accidents that happen to people, how that story built, how something happened, what could have been avoidable. I love listening to those things, and I think they're great resources. I will caution, don't listen to them on the way to climb. I've scared the crap out of myself doing that, because there are a lot of things that happen very easily. But if you've safely wrapped up a climbing trip and you're driving home, then yes, check these things out.
I would like to plug SLCA. They are looking for volunteers all the time, and they are great mentors. And they are the ones that will go and replace bolts like the SMC death hangers I was talking about and make our routes safer. And that's their goal. So if you want to volunteer, they're always looking for help. So.